Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. Series 3 of the Family Health podcast is sponsored by Savlon Scar Prevention Gel. Savlon Scar Prevention Gel speeds up healing, helps soothe pain, and reduces the likelihood of scarring when used on minor wounds, superficial burns, and grazes. And to be frank, with my 6 children in my house, cuts, scrapes, and grazes are plentiful. So my first aid kit, saviour, is Savlon Scar Prevention Gel. Hi, I'm Kate, and I am the founder of Mini First Aid. Welcome to our podcast, Family Health by Mini First Aid. I'm really pleased that you've taken the time to listen to our podcast, because whether you're in the car, you're cleaning the house, relaxing with a cuppa, or maybe you're on your way to work, Family Health Podcast covers a huge range of topics that might affect one of your family members. And if you've ever got a family health concern and you're thinking, I'm going to Google that, then please don't. Please have a listen to us instead. Now, I'm thrilled to introduce our guest this week, Dr Hannah Hobson from the Department of Psychology at the University of York. That's like a tongue twister for me, Hannah. I've had to read all of that. Hannah has vast experience with neurodevelopmental conditions. And we've already been fortunate enough to tap into Hannah because she wrote a blog for Mini First Aid about autism. And we're going to focus on that in today's podcast. So, Hannah, welcome to the Family Health Podcast. Hannah, I've obviously given you that rather long intro with your job title, but can you explain a little bit more eloquently for me, a little bit about me, about you, to me, about what you do?
Yeah, absolutely. So I work at the University of York. I'm a psychology lecturer. So a big part of my role is actually teaching on our master's course, Development Disorders and Clinical Practice. So we teach postgraduate students about neurodevelopmental conditions like autism and others as well, and how those children may be to work with clinically. When I'm not teaching, I'm doing my research. I direct what's called the Emerald Lab. So that's emotions and mental health research in autism and language disorders, where basically I do research on the role of language and communication and how it affects mental health. And topics like autism and developmental language disorder come under that big umbrella. So a bit of teaching, bit of research, lots of stuff about neurodevelopment.
Busy.
Yes,
sounds a busy job. Now, I'm sure there are a lot of people out there that don't fully understand what autism is. So they hear the word used a lot, or might know somebody, or they might be wanting to know more around autism diagnosis. Can you explain to our listeners in very simple terms, what is autism?
Yes, so autism, I'm going to start my answer with autism is really variable, and it's a little bit of a saying. If you've met one person with autism, you've met one person with autism, because there really is a lot of variety amongst autistic people. But the main things that kind of characterize autism are difficulties with what we call social communication and what we call restricted and repetitive interest. So if you're thinking about a diagnosis of autism, you're looking for clues of both of those things together. So social communication problems, that can be having difficulty understanding what people are saying, especially when they don't mean literally what they're saying. So when people are being sarcastic or having a joke. That could also be things that are unusual about eye contact. So eye contact's become a little bit of a stereotype about autism. So not all autistic people don't look you in the eye, but difficulties with eye contact are fairly common. It also might be, we might see difficulties in language development as well, but I would say that for some autistic people, they're extremely articulate. You wouldn't suggest there's anything wrong with their language, but we get a lot of variation there as well. So those are sort of social communication problems. When we think about what's called restricted and repetitive interests, so that can look like having a very intense or very unusual interest. Our minds tend to go to dinosaurs and Minecraft, but actually, I've worked with children where they were really into drain covers. That was the thing that they every time they went over a drain cover, they really needed to stop and look at it. For some interests, they might not strike us as unusual, even if they're very intense. And I think this is something that's quite important about autistic girls is a really intense interest in a particular boy band or with makeup might look developmentally very normal, because aren't all girls into makeup and aren't all girls into whoever it is. But so it's sort of worth tuning into not necessarily exactly what the interest is, but how intense it is as well. So intense interests are one thing we look for. In young children, it might affect their play. We might see autistic play a little bit differently. So rather than lots of role-playing games, you might see children lining up toys by size or colour, wanting to do the same action like spinning again and again. You might also see what we call stimming. So this is where children or young people might do particular movements. So hand flapping is quite common, rocking as well. So we do see non-autistic people stimming as well, but we see stimming a lot in autism, although some autistic people suppress their stimming because they're worried about what other people might think about them. And the last thing to mention is some sensory differences. So for some autistic people, things like bright lights, noisy electricity can feel very overwhelming. They can also have unusual things going on with kind of taste and touch. So they might find certain fabrics really scratchy and things, which for young children, it can be really difficult for them to communicate that's what's going on. So that can like a lot of frustration. So that's a lot of detail, but what we're looking for really are issues with social communication, issues with restrictive and repetitive interest, both of those things. But either of those can look very, very different depending on the age of the child and other things that are going on.
And that's interesting when you said that no two autistic people will be the same. And I know you said that in our blog for us, and that have talked about the different things that you might see or observe in someone with autism. We often hear about something called the spectrum, and people throw the word, oh, they're on the spectrum. What is a spectrum, and what actually does this mean, Hannah? Tell us.
It's a really, really good question. So I think we end up using this spectrum idea in a couple of different ways. So I think one way we might talk about a spectrum is this idea of lots of variation. We're kind of talking about the spectrum of autism and how different autistic people can be. I think the other way that we might think of the spectrum is actually thinking about a spectrum across everybody, not just autistic people. And the idea, ages ago, we kind of maybe used to think of autism as one thing all by itself over here, and non-autistic people, in a different place. Actually, that's not really how people work. It might be better to think of some people who are very high in autism traits, some people who are very low, and then lots of us are in the middle, actually. And there's not necessarily a really clear line between somebody who is autistic and somebody who is not autistic. So I think the idea of a spectrum helps us kind of think about how, autistic people and non-autistic people are on a continuum, you could think. Mm-hmm. And some people are going to be high or low, some people are going to be in the middle. Some people have argued that this word spectrum can be a bit tricky in that it sort of suggests a line, like autism traits high over here, low over here. So some people have started to sort of say, oh, it's more like a web or something a little bit more.
Yeah, I've heard this.
That. Yeah, and I think that's quite a helpful concept because it kind of breaks us away from trying to work out like where are we on the spectrum, and instead thinking about autism as something a bit more complicated, and that different autistic people might have quite different webs, and we all might have sort of different web type profiles, essentially. Mm-hmm. But that's what I think. So I think the idea of a spectrum emphasizes how variable autism is and how autism isn't its own thing off over here by itself, that it's sort of part of human difference more broadly.
Mm-hmm. Now, it seems to be in the public consciousness more. We seem to hear about autism more. We certainly hear from our schools, for example, a lot more pressure on learning support teams, etc., around diagnosis for children with autism. What's happened? Why suddenly has it really sort of appears to have accelerated in public consciousness? What's happened?
So I think it's a number of things. Like all things, there's really one quick answer. So I think one thing is that if you're thinking you're hearing about autism a lot more, you are. People are getting there are an increase in diagnoses of autism. More people are receiving a diagnosis, more children are receiving a diagnosis. Now, for some people, that might feel alarming, like what's going on, like why are more people suddenly autistic? It's probably not the case that more children and young people are autistic. It's probably that we're actually a little bit better at detecting autism than we were 10, 20 years ago. So I think our detection and awareness has gotten a lot better, and that means more people are being referred and potentially diagnosed. The other thing is, compared to 20, 30 years ago, the picture of what autism has really changed. So back when we sort of first coined the term in the 1960s or so, autism was a very specific thing, and it was quite male dominated. We didn't tend to think about what happened to adults who are autistic, whereas now actually we still have some ways to go, but we are better at spotting autism in females, women and girls. And there have been some studies where when they've actually taken sort of autism measures to an adult population, a large adult population, they found that actually you get a similar rate of autism in that population as you do in children, which I think helps make the point that it's not that more children are becoming autistic, but actually adults who today would maybe get an autism diagnosis if they're a child now didn't get that when they were younger.
Okay.
Yes.
Do we have statistics on the number of people that are diagnosed with autism in the UK? Have you got it? Do we know what it is?
Yeah, so the rate that's normally talked about is about 1 in 100, or about 1%. The National Autistic Society says that's actually probably on the low end. So that is probably still missing people who don't realise they're autistic, or who, for whatever reason, don't want to pursue a diagnosis. So if we talk about 1%, it's probably a little bit more than 1% in reality.
So with autism, and I'm asking the questions really from my from my sort of lack of knowledge, but also for people that perhaps are confused by some of the messaging. Is autism present from birth? And does it get, I don't like using the word, but worse, or can it get better? I don't know what those measures are, but what happens?
So it is present from birth. So with neurodevelopmental conditions like autism and like ADHD and other conditions as well, we think of them as a neurotype. You're born with that neurotype. The kind of characteristics of autism, they might not become obvious for a few years. So, you might get diagnosed when you're in primary school, secondary school. We're now seeing a lot of adults and university students who get a diagnosis. If you get a diagnosis while a university student, you had autism all along. It's now only been diagnosed. So for some people, those characteristics come out at different ages. Often it's when they've managed, I think, in primary school, despite having autism, and then they maybe hit secondary school and actually now it's too much, and it starts to become obvious, I think, that a child is sort of struggling relative to their peers. For some people, that's at university. For some people, that's in the world of work. That's when they really discover there's something that other people can do that they're finding hard, and that might prompt a diagnosis. So no, it is present from birth. In terms of things getting better, things getting worse, so children and young people with autism, with support, they can develop many skills. So they certainly can get better in terms of their communication, in terms of their social skills. There's lots of sort of support that we can give people with autism. In terms of things getting worse, so certainly autistic mental health can get worse. I mean, that would be the thing that springs to my mind, is that an unsupported person is at risk, I would say, with their mental health. The other thing in relation to getting worse is we do have this phenomenon, or this thing that happens for some families with autism, where they experience what's called a regression. So this is something that really happens in the early years. So this is, children before age 5. Some families feel like their child actually has skills that then get lost. And that's normally what prompts them to then seek help and perhaps get an autism diagnosis. So that regression is normally in the sort of toddler years. So the feeling that they had some language that they lost, for example, or they were doing gestures and then they stopped. We don't really know why that happens. We don't think it's that something happened and they caught autism. And actually the evidence suggests that where we have been able to collect data from families we knew are at risk of having autism, maybe because they have an older child who has autism. The children who actually experience a regression and go on to get an autism diagnosis later, you actually can see some subtle differences before the regression episode. So it's not that something's happened and they've then gained autism, but we don't really know why it is that they might appear to lose skills that they have. Okay. So that can happen. And yeah, we don't really know quite why at the minute.
What for parents, and you know your own children, right? So, but what can be early signs of autism that might prompt a parent to seek some professional advice or talk to their childcare provider?
Yes, so I'll describe some early signs that we might see in toddlers. Mm-hmm. Now, I'm just going to say that, if you're in the car and thinking, oh my gosh, my kid does this, don't think that necessarily means all children do this to some extent. So if they're doing one or two of these things, that's probably not a cause for concern. So some of the sort of early milestones that an autistic child might not make at the expected time would be things like responding to their name by about 9 months, playing interactive games, things like pat a cake, those sorts of dancey singing games by about a year. Not much gesture. So one of the kind of early gestures that we often see in our children is waving goodbye, bye-bye. Mm-hmm. So not seeing gestures like that. Not sort of sharing interests with caregivers. So, if something's really interesting, normally a 18-month-old will bring it to you, to show you, to share in what they're enjoying looking at. So limited use of that, limited pointing as well, a year and a half. And by age 4, maybe limited role play, so where children might pretend to be a teacher or a doctor or a superhero, that sort of thing. You might also see what we call echolalia. So that's where children repeat words and phrases over and over. Now, all children do that to some extent, and actually imitation is a really good way for children to learn. The sorts of echolalia you might see in children, who are 3, 4, 5. They might repeat things like the sat-nav was one that a child that I worked with would do quite a bit. So sort of seeing a lot of echolalia and sort of unusual repetition. Being upset by minor changes. So for children with autism, they're quite routine driven. Routine really helps them feel safe and secure. So changes or unexpected things might be quite upsetting. Again, all children to some extent thrive on routine, so big caveat with that one. You might see the stimming, so some hand flapping, some rocking in young children with autism. And you might also see perhaps some unusual reactions to things like sounds or smell or taste in toddlers as well. So that's quite a big, long list. So again, if you're seeing one or two of those things, it's unlikely to be autism. If you're seeing a lot of those, then it could be that your child is exhibiting a sort of autism profile.
And then do you go with it, or how do you support a child if they're starting to display signs of autism? What do you do?
So I think if you are wondering whether your child is autistic, I think it's a really good idea to engage with your GP. If your child's at nursery, talk to their early years professionals, or if they're at school, their school teacher, to see what they've observed and see, what do they think? Do they see the same things at school or at nursery? Would your GP be concerned? I think if there are other things like language delay, so, it's one thing if a child's playing with things in a certain way and gets upset when routine is changed. But if you're also worried about their language development and other aspects of their cognitive development, it's really always worth going to speak to your GP, even if you don't think it's autism. So I would say these days, the approach to sort of supporting autistic children and young people, so autism isn't going to go away. And actually, so we've kind of moved on, I think, from trying to cure autism or remove autism. And actually, in the last, I'd say, 10 years, we've had what's called the rise of the neurodiversity movement, which is really about, accepting neurodivergence and, saying, okay, autistic people are part of the really rich tapestry that is human difference. And isn't it wonderful they're here, and how can we support them? So it's not about trying to remove autism. for children and young people with autism, they still might benefit from support. And that's not trying to remove their autism, but it is trying to make sure that they have got good communication skills, that they have the social skills that they would like, that they're suitably supported in school. So I know from some of the work I've done on masking that for some autistic children and young people, they feel pressure to kind of hide their autism and their autistic differences. Now, we'd call that masking. We know that lots and lots of masking, if you're doing masking all the time because you just want to appear like everybody else and fit in and be liked, it's really tiring. It's really tiring.
Of course,
and actually it can make you feel not very authentic because you're kind of putting on a performance. So I don't know if I'd say it's so much going with the autism, but I think certainly accepting the autism, and maybe your autistic child isn't going to look like everybody else, but that's okay, and sort of being able to support them to be who they want to be and who they are authentically, I think is really important. And I think I think a diagnosis does help in order to know that that's sort of maybe a good explanation for why your child may struggle with certain things. So I think if you're thinking, do I go with it, I'd definitely seek a diagnosis, or certainly seek some other professional opinions about what might be going on.
So I want to ask you about diagnosis because we know the education sector particularly are very stretched. And speaking from personal experience here as well, sometimes if you're seeking diagnosis, we're being presented with years, literally years of waiting time. So what happens in the interim, and is it essential that your child gets a diagnosis, or can you just live with it knowing but not actually ever having it professionally confirmed?
So I think actually a lot of families are kind of living under that experience you've described. Even if they would like a diagnosis, they're living with the expectation. They think their child almost definitely is autistic, but they're waiting years to get the diagnosis. They're kind of in that phase, even if that's not where they'd like to be. To be frank, the reality is that the waiting times are quite long. So certainly a part of that is because of who you need. Quite a specialist team. It's actually not even one person, it's normally a team that feed into making an autism diagnosis. So that, there's some reasons why it takes a while, because we need these people to be available to do the diagnostic assessment sessions. It is pretty bleak. I was looking up a report from the Royal College of Psychiatrists recently, where finding that people were waiting, on average, 9 months. This was a year ago, for an assessment session, and that's really concerning. So it can be long. In terms of whether it's worth getting, starting that process, it's a really personal decision, I think, for families as to whether they want to go forwards for a diagnosis or not. So some families might be concerned that it's going to create stigma. Yes. That by a child having a diagnosis, that's going to in some way stigmatise their child, or even them as well. I'd love to say that there are no people with autism stereotypes and that your child would never face any stigma. That's not the world we live in. What I would say is I think they're probably going to face stigma anyway if they have autism characteristics, even if they don't have a diagnosis. They still have those characteristics and those traits, right? So by not having the diagnosis, I'm not necessarily sure it totally does remove the stigma that you and your child might experience anyway. And I think we are kind of living in a moment where increasingly, because of the neurodiversity movement, or certainly in part because of that, there's much better acceptance, there is better support, there's better peer support, I think, for autistic children and youth. So if it was me, I would accept that it might be a wait, but I'd probably get on the waiting list, I think. And in the meantime, I'd make use of charities that support autism. There are some really good resources. The Girl with the Curly Hair is a particularly nice resource, and sort of try and make use of what's out there anyway in the meantime to help you understand your child better. And it might be after you read that stuff, you go, oh, maybe it wasn't that after all. But that's still helpful, I think. But yes, the reality is that it is quite a long wait, unfortunately.
And when you talked about, I know you talked about rather than a spectrum as having a web, is that there undoubtedly will be some children that have some autistic traits, but it's not. Can it be mild, and therefore easier to manage in a mainstream and standard setting? Is that
yeah? So we might absolutely, yeah. So we might think about some autistic children having like high needs, and some autistic children, they still have autism, but their needs and the support that they need are going to look maybe quite different. So for some children with autism, they might also have intellectual disability. They might be minimally verbal, so they might not communicate. They might communicate by other means, via things like we have picture book systems or some really amazing tech now that kind of supports minimally verbal people to communicate. They might, be people who we think they're unlikely to live independently. Whereas you might have some children with autism who are extremely articulate, can tell you exactly what they think, but who are really going to struggle socially and still might really struggle to kind of organise themselves and sort of survive in a busy secondary school environment. So it is a real mix. So, as I think we've said, you've met one person with autism, you've met one person with autism. Some autistic people, might feel they don't really need very much support, thank you very much. And not all autistic people perceive autism as a disability.
No, of course.
They don't consider themselves disabled. Other autistic people go, no, I have autism and that's fine, but it is a disability. I would perceive it that way. So there's a lot of variety in how it's viewed. And I think parents of autistic children might feel sort of similarly in that for some they might go, no, it's just a bit of who my child is and that's the end of it. Versus for some, actually, it's a disability and they want the diagnosis in order to access quite a lot of more intense support. So it really varies. Really.
Can you access support both in the voluntary sector but also in your childcare and education without a diagnosis?
So I think it will vary a little bit. So the diagnosis will certainly help unlock some additional support.
Okay.
In my experience. So I think really the education sector, it says it doesn't like to work to medical diagnoses, but it feels to me like the reality of the sort of system of, say, educational healthcare plans, it seems to me like having a diagnosis and having certain diagnoses does seem to unlock support. That just seems to be the reality on the ground. But I do know of schools where if, say, they strongly suspect a child has got autism, the parents think so, the GP thinks so, you've done the referral, you're going to wait for a while perhaps, that school might go, okay, well, we can still do some stuff. They can still make some changes and support your child, as best they can, assuming it is autism. So you don't have to have a diagnosis, I think, to maybe prompt your teachers to work with your child in a slightly different way. But I can't say that's true for all schools, but I've certainly heard of schools who've gone, okay, well, we know it's going to be a year until he's maybe seen by the autism specialist. So in the meantime, why don't we make a visual timetable? Let's put in some social support here. We can make sure you have regular access to things like our emotional literacy support assistants, who are sort of teaching assistants trained to sort of support children with social emotional needs. So, schools can do some stuff, basically, without a diagnosis.
Great. That's fine. I think it's all absolutely fascinating. And I think just, I guess, from anecdotal and personal experience, sometimes the frustration in getting that first, right, we're going to refer you and you're going to get assessment. Yeah. But you do need to talk to your GP as well. Is that right?
Well, so I would talk to your GP. Again, I've had experiences not just with autism but with other neurodevelopmental conditions as well, where families said, well, I spoke to my school and they said speak to your GP, and I spoke to my GP and they said speak to your school. So, and that can be really frustrating for families if they feel like they're being ping-ponged between
back and forwards.
Really annoying. I'm afraid I don't have a solution other than to be like, well, you said go to here and they said go to you, and someone needs to make the referral. Let's get this going. And it shouldn't really be parents or families' job to be working out who should be doing the referral. But, be persistent, I think, if that's
make
what you
some
want
noise.
To do. Yeah, unfortunately, yes, which I don't like to say, because there'll be lots of families who are not in a position to make noise. And then what happens to those? It's not right, is it? But yeah, I mean, I think that is the reality on the ground at the minute.
Hannah, can I ask you about assessment then? So if you were mentioning then that if a childcare provider or a school had put in place a support system prior to any diagnosis. So they were saying, actually, we'll put a visual or we'll do something that means that that child can have a happy and functional time at school. Does that mean then that they don't present as strongly as a case because they're seemingly managing in their setting so when it comes to diagnosis, somebody looking at a child that actually is being really well supported would go, yeah, they look fine.
They seem fine. Yeah.
It's
a really good question. So I think actually when families go for an autism assessment, I think the sorts of assessments that would be done, I think it would be quite unlikely for the support your child might have received in the meantime to have really made it such that they weren't going to meet the diagnostic criteria. So if you go for an autism diagnosis, so part of that usually is an autism observation assessment where it varies depending a bit on the age of the child and if they're verbal, but there'll be kind of little interviewee things, little activities where the clinician is sort of trying to look at how reciprocal are this child's interactions with me. They're looking for those social communication differences, essentially, in the context of that session. And then usually there'll be an interview done with the parents or the caregivers to talk about that child's early development, and they're looking again for clues as to social communication problems, but also clues about restricted and repetitive interests as well. And then they sort of bring the evidence from these different assessments together to then make a clinical decision about whether it's going to be an autism diagnosis. So I think if you've got a child who's got autism because they've got some social communication differences and some restricted and repetitive interest traits, even if they're really happy at school, fantastic, that's great, that I'm fairly confident those two assessments would still identify the autism characteristics. So I wouldn't worry that if your child's getting help at school, that's somehow going to undercut the diagnosis later. I think that's fairly unlikely.
And you get a diagnosis, say, what happens after that? Where do you go? You've got your report, or you've got your piece of paper that confirms what you've always known for your child. What happens after that? What do you go do?
So I'd love to say that there was loads of really good post-diagnostic support for autism. Some places do better than others, but so there's a kind of administrative element to it, which is that, that might now be going into an education healthcare plan. You might be going back to your child's school and you've got an autism diagnosis, so now what does that unlock? But I think it is probably important to stress that, as you sort of said, it's what you've probably already known. Your child doesn't change the day after they get a diagnosis. They're the same. Their difficulties and their strengths as well will be the same as they were before they had the diagnosis confirmed. So although it can unlock certain help, and when they're adults as well, I think that's also important to stress that this is something your child, if they grow up and go to the workplace, they can choose to disclose to an employer, and then they are covered by the Disability Act, Rights Act, which is quite useful, I think, for some people. But in terms of what you do after the diagnosis, so for some families, just thinking about what happens emotionally, it's usually a kind of complicated feeling of relief, maybe. So, someone's kind of confirmed it. You knew you felt you knew that's what it was, and someone's agreed with you. There might be a bit of anger. So particularly when we've worked with autistic women who are diagnosed in adulthood, they get relief because they feel that there's an explanation for why they've perhaps had certain struggles. There's often a bit of anger that someone didn't spot it sooner, or what they've had to go through with undiagnosed autism. So that might be in the mix as well. So I think it's worth families kind of acknowledging they're going to have some complicated emotional reactions to a diagnosis of autism, perhaps, and sit with that and not judge yourself for it. And then I think it's worth engaging with, there's lots of charities around autism, but there's normally some good local communities. Meeting other families of autistic children, having some peer support, I think is really helpful, both before and after the diagnosis, to be honest, so that you've got people who have gone through the process as well and who understand what it's like. I think it's a really good idea. Get involved in the neurodiversity movement as well.
Yeah, well, what we'll do, Hannah, is with the references that you've given us, we will share them on the show notes for today's podcast, so that people can review those and take an opportunity to sort of digest those and have a look for more information. we always ask, as we're wrapping up our podcast, for our expert guests to give us a takeaway. So one thing that if people have been listening today that you would like them to take away, what's yours, Hannah?
I'm going to be really cheeky and have two things.
Okay, we'll let you on.
Yes, I'm going to. One is for parents of autistic children, and one is for parents of non-autistic children, actually. So I think for parents, I'll start with the parents of children who aren't autistic. If you're listening to this and you're going, well, this isn't my child, so interesting, but not for me. One thing that I think your family could do to make life better for autistic children and their families is to try and help your family appreciate neurodiversity. So we know that one of the things about being autistic is really hard is having to deal with other people's stigma and stereotypes and misunderstandings about autism. And you can be part of the solution to that by kind of talking to your children early on about human difference and how some people might be a bit different, and joining in sort of autism acceptance months and that sort of thing. So I would really kind of prompt families listening, even if you don't think your child's autistic, to maybe think about how you can help make society safer and more acceptable for our autistic society members. If you are families of children who do have autism, so I think one of the things we've talked about variation in children and young people with autism. Families are also really varied as well, and families are going to make different decisions for their own children that might not look like your decisions. I think it's really helpful if we can all be kind to each other and kind of appreciate that normally as a parent you're almost always trying to do the best thing for your child, and someone's decisions might not look like yours, but yeah, it's a very sensitive topic. How do you support a child with autism? Mm-hmm. And being kind and appreciating that people might be trying out different things, I think is good, and that other people might take approaches that you might not take is good, as long as everybody's safe. Let's all be kind to each other.
Hannah, that's really insightful. Thank you very much. You've been listening to Dr Hannah Hobson. She's been talking to me today about autism, particularly in children. Hannah, thank you for joining us today. It's been really, really interesting. You've been listening to the Family Health Podcast, and as always with the Family Health Podcast, make sure you subscribe, because then if you subscribe, each episode just drops into your listening device. It's genius, brilliant. You can also follow Mini First Aid on socials, which will mean that you'll get updated about what podcasts are coming soon and other family health related advice. And if you sign up to the Mini First Aid newsletter, you get it in your inbox every week, and you can look back actually on the Mini First Aid website. I should mention that the wonderful article that Hannah wrote for us on autism is available on the Mini First Aid website. Go and take a look at that. So if you've got any other subjects, family health related subjects that you would like us to cover at a later date, please don't hesitate to get in touch, because we love finding experts to give you the information that you need. Thank you very much for listening to the Family Health Podcast. Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. I take Savlon Scar Prevention Gel everywhere with me so that I am always prepared for the many little and sometimes bigger accidents that my kids encounter. Thank you again to Savlon Scar Prevention Gel for sponsoring Series 3 of the Family Health Podcast.